Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on hypertension, myocardial infarction, heart failure, and arrhythmias, with 4 answer choices and detailed explanations. Cardiovascular clinical vignettes: hypertension, myocardial infarction, heart failure, arrhythmias. 1. Hypertension and end organ damage. A 55-year-old man with a history of untreated hypertension presents with headaches, blurred vision, and confusion. His blood pressure is 220 mmHg. Fundoscopic exam shows papilledema. What is the most likely diagnosis? A. Primary hypertension. B. Pheochromocytoma. C. Hypertensive emergency. D. Renal artery stenosis. Answer C. Hypertensive emergency. Hypertensive emergency is defined as BP 180 120 mmHg with end organ damage, e.g. papilledema, altered mental status. It requires immediate BP reduction. 2. Secondary hypertension. Renal causes. A 35-year-old woman presents with resistant hypertension despite multiple antihypertensives. She has abdominal bruits and a history of fibromuscular dysplasia. What is the most likely cause of her hypertension? A. Conn syndrome, primary hyperaldosteronism. B. Renal artery stenosis. C. Cushing syndrome. D. Pheochromocytoma. Renal artery stenosis. Explanation. Renal artery stenosis leads to increased renin-angiotensin-aldosterone system RAS activation, causing hypertension resistant to treatment. MASH 3. Myocardial infarction. A 60-year-old man with diabetes and hypertension presents with crushing chest pain radiating to his left arm for 45 minutes. His ECG shows ST elevation in leads V2, V4. What is the most likely diagnosis? A. Inferior myocardial infarction. B. Anterior myocardial infarction. C. Pericarditis. D. Unstable angina. Answer B. Anterior myocardial infarction. Explanation: elevations and lesions in leads V2, V4 indicate an anterior MI, usually due to LAD, left anterior descending, artery occlusion. 4. Myocardial infarction complication, ventricular rupture. A 67-year-old woman had a STEMI 5 days ago. She now presents with hypotension, JVD, and distant heart sounds. What is the most likely complication? A. Papillary muscle rupture. B. Ventricular free wall rupture. C. Acute pericarditis. D. Cardiogenic shock. B. Ventricular free wall rupture. Explanation: ventricular free wall rupture occurs 3-7 days post-MI due to myocardial necrosis. It leads to cardiac tamponade, hypotension, JVD, muffled heart sounds, Beck's triad. 5. Heart failure with reduced ejection fraction. A 72-year-old man with a history of myocardial infarction presents with dyspnea, orthopnea, and bilateral leg edema. Echocardiogram shows EF 35%. What is the best initial treatment? A. Hydrochlorothiazide. B. Digoxin. C. Lisinopril and carvedilol. D. Amlodipine. Answer C. Lisinopril and carvedilol. Explanation: heart failure with reduced ejection fraction is treated with ACE inhibitors, lisinopril, reduces afterload. Beta blockers, carvedilol, metoprolol, bisoprolol, reduces mortality. Diuretics for symptoms only, not mortality benefit. 6. Heart failure with preserved ejection fraction, HFpEF. A 78-year-old woman with a history of hypertension and diabetes presents with dyspnea on exertion and lower extremity swelling. Echocardiography shows EF equals 60 cent and left ventricular hypertrophy. What is the most likely diagnosis? A. HFrF, B. HFpEF, C. Restrictive cardiomyopathy, D. Acute pericarditis. Answer B. HFpEF. Explanation: heart failure with preserved ejection fraction is associated with diastolic dysfunction due to left ventricular hypertrophy from chronic hypertension. SHAR 7. Atrial fibrillation and stroke risk. A 75-year-old woman with atrial fibrillation and hypertension has a CHA-DS2 VAS-C score of 3. What is the best treatment to prevent stroke? A. Aspirin, clopidogrel. C. Warfarin or a direct oral anticoagulant. D. No treatment needed. Answer C. Warfarin or a direct oral anticoagulant. Explanation: HADS2 VAS-C score requires anticoagulation, e.g. warfarin, apixaban, rivaroxaban, to prevent stroke and atrial fibrillation. 8. Ventricular tachycardia VT and sudden cardiac death. A 40-year-old man collapses while jogging. Bystanders initiate CPR. EMS arrives and finds him in pulseless ventricular tachycardia. What is the next step? A. IV amiodarone. B. Immediate synchronized cardioversion. C. Immediate defibrillation, D. IV atropine. Answer: C. Immediate defibrillation. Explanation: pulseless VT and ventricular fibrillation VF require immediate defibrillation, unsynchronized shock. 9. Wolff-Parkinson-White WPW syndrome. A 25-year-old man presents with palpitations. ECG shows short PR interval, delta waves, and a wide QRS complex. What is the best treatment? A. Beta blockers, B. Verapamil, C. Amiodarone, catheter ablation. Answer: catheter ablation. Explanation: WPW syndrome is treated with catheter ablation to eliminate the accessory pathway. 10. Torsades de Pointes and QT prolongation. A 32-year-old woman with a history of long QT syndrome develops syncope. ECG shows polymorphic ventricular tachycardia with twisting QRS complexes. What is the first-line treatment? A. IV magnesium sulfate, B. IV amiodarone, C. IV beta blockers, D. Immediate synchronized cardioversion. Answer: A. IV magnesium sulfate. Explanation: torsades de Pointes, a type of polymorphic VT, is treated with IV magnesium sulfate, which stabilizes myocardial repolarization. Key takeaways: hypertension, look for hypertensive emergency, BP 180-120 with organ damage. ST elevation in specific leads helps identify the affected artery. Heart failure, HFrF, EF 40%, needs ACE inhibitors plus beta blockers. Recognize ECG findings, AFib, WPW, V torsades. Let me know if you need another cardiology topic.